Hi, this is Dr. Ina from MyWeight. I'd like to address common misunderstandings related to compounded GLP-1 analogs. This is a post by Weight Watchers Clinic.
There are many reports, even from the FDA and other companies out there, finding impurities in these compounded versions of these GLP-1 medicines.
Indeed, it is certainly possible that there are substandard quality GLP-1s out there, and also counterfeit medication. But that should not discredit all compounding pharmacies making copies of GLP-1s. We need to understand that when a drug is on the shortage list, federal law specifically allows compounding pharmacies to make exact copies of an FDA-approved medication. The legislation meant to protect patients and allowing them continued access to life-saving medications. Doctors are probably not aware that compounded copies of FDA-approved medications are being used all the time by healthcare facilities, including resuscitation medications, chemotherapy, and antibiotics. It is unclear why GLP-1 analogs should be treated any different.
There are only two legitimate sources for these medicines, and they are the FDA-approved manufacturers, and they are not giving this compound out to anybody else. So anybody using a compounded version are getting illegitimate sources of the GLP-1 medicine.
This statement is flatly incorrect. FDA-registered API are listed on the FDA website. For example, for tirzepatide, we see it's listed from Eli Lilly, but also from other manufacturers making bulk ingredient for human prescription. So these are totally legitimate pharmaceutical grade API, in the case of tirzepatide, not from Eli Lilly. The same you can see for semaglutide.
We're not against compounding medicines in general. A lot of people, including myself, have compounded creams and pills using FDA-approved medicines. However, when you do injections, it bypasses the natural bodily defenses, such as your skin or your GI tract, and can cause major issues, such as seen in the past with meningitis in the brain.
The meningitis outbreak in 2013 is what's led to the FD&C Act regulating those compounding pharmacies. So sterile compounding pharmacies like 503A and 503B, which is a sterile outsourcing facility, are compounding sterile medications for intravenous and even epidural use. So again, these medications are non-FDA approved medications, and they are used all the time in hospitals and other healthcare settings. The same pharmacies are now compounding GLP-1 analogs medication, which have much lower concerns of sterility.
To summarize, we at Weight Watchers will only prescribe FDA-approved GLP-1 medicines and will not compromise patient safety by prescribing compounded versions of these medicines.
So if you still have doubts about safety, you can easily confirm it with certificate of analysis. These medications are hard to find these days. So after confirming safety with certificate of analysis and knowing that the law is allowing you to prescribe an exact copy of the branded medication, and the FDA is regulating these pharmacies, which are used routinely even for IV medications, and you decide not even to suggest it to your patient, even the sickest ones, I just don't think this is a rational approach, weighing the risk and benefit in this case. I think this is also contradicts the intention of the FD&C Act.